Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. The United Kingdom's National Health Service is leading the world with the rollout of a revolutionary treatment for multiple myeloma. Known as belantamab mafodotin, this therapy functions as a Trojan horse, delivering chemotherapy directly into cancer cells while sparing healthy tissue. This targeted approach allows patients to potentially control the disease for up to 3 years, triple the current average. Clinical experts highlight its promise, with early data suggesting that over half of treated patients may achieve long-term remission. In mental health news, Psilocybin, a compound found in psychedelic mushrooms, has demonstrated significant long-term antidepressant effects in cancer patients. A recent study published in JCO Oncology Practice administered a single 25 milligram dose of psilocybin combined with psychotherapy. Results showed reductions in depression and anxiety lasting up to 2 years, with more than 50% of patients reporting lasting emotional benefits. Many describe the experience as transformative. While the findings are promising, researchers cite the need for larger trials and note that legal hurdles remain a major barrier to clinical adoption. Early cancer detection has taken a significant leap forward. Researchers at Johns Hopkins have developed a blood test capable of identifying cancer-related DNA mutations up to 3.5 years before clinical symptoms appear. Among 52 individuals studied, 8 showed detectable mutations long before diagnosis. This breakthrough could transform cancer screening, making it more routine, non-invasive, and effective in improving long-term survival outcomes. In adolescent mental health, a new study involving over 4,000 teens has revealed that emotional dependence on digital devices, rather than screen time alone, is strongly associated with suicide risk. Teenagers identified as screen-addicted were 2 to 3 times more likely to report suicidal thoughts or behaviors. By age 14, 18% had experienced suicidal ideation, and 5% had formulated or attempted plans. Experts urge parents and educators to shift focus from screen limits to the quality and emotional impact of digital engagement. A major meta-analysis published in the journal Heart has found that cannabis use is associated with significantly elevated cardiovascular risks. The analysis, which reviewed 24 studies from 2016 to 2023, revealed a 2-fold increase in cardiovascular death, a 29% higher risk of acute coronary syndrome, and a 20% greater likelihood of stroke. Health experts emphasize the need to treat cannabis similarly to tobacco, legal but discouraged, especially among young adults, where consumption is on the rise despite limited public health messaging. A groundbreaking study published in The Lancet suggests that dementia prevention should begin much earlier than previously thought, possibly in childhood. Factors such as early life cognitive ability, childhood obesity, and maternal smoking were all linked to future dementia risk. Researchers argue that prevention strategies should include reforms in education, public health, and environmental policy. The overarching message is clear: it's never too early to invest in lifelong brain health. Finally, researchers in China have introduced an innovative, non-invasive diagnostic tool for Parkinson's disease. By analyzing chemical compounds in earwax using artificial intelligence, they achieved a remarkable 94% accuracy in detecting the condition. The study identified 4 key markers, including ethylbenzene, as indicators of Parkinson's disease. This approach could offer a cost-effective alternative to current diagnostic methods, pending confirmation through larger, multi-center trials. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email